Asthma is the common chronic inflammatory disease of the airways, characterized by variable and recurring symptoms, reversible airflow obstruction, and bronchospasm. These symptoms include wheezing, coughing, chest tightness, and shortness of breath. The inside walls of the asthmatic's airways are swollen or inflamed. This swelling or inflammation makes the airway extremely sensitive to irritations and increases your susceptibility to an allergic reaction. As inflammation causes the airways to become narrower, less air can pass through them both, to and from the lungs. Symptoms of the narrowing include wheezing, which is a hissing sound while breathing, chest tightness, breathing problems, and coughing. Asthmatics usually experience these symptoms most frequently during the night and the early morning. Asthma is not so much treated as it's controlled. As a chronic long-term disease, there is no cure. But there are tools and medicines to help you control asthma. Medications for asthma is broadly categorized as either long-term control medicines or quick relief medicines. Reducing airway inflammation and preventing asthma symptoms is the goal of long-term control medicines, whereas immediate relief of asthma symptoms is the goal of quick relief or rescue medicines. Medications can be ingested in pill form, but most are powders or mists taken orally using a device known as inhalers. Inhalers permit medicine to travel efficiently through the airways to the lungs. Long-term control medicines are taken every day, and they are designed to prevent asthma symptoms such as airway inflammation. Inhaled corticosteroids are the most effective long-term control medicine, the best at relieving airway inflammation and swelling. They are usually taken daily to greatly reduce the inflammation that initiates the chain reaction of the asthma attack. Even if taken every day, inhaled corticosteroids are not habit-forming. However, the medicines do have side effects such as mouth infection, known as thrush. Thrush occurs when the corticosteroids land in your throat or mouth. Spacers or holding chambers have been developed to help avoid this. Thrush can be also avoided by rinsing the mouth out after inhalation. There are other long-term controlled medicines available that the doctor may prescribe. Most of them are taken by mouth and they are designed to open the airways and prevent the airway inflammation. Examples include inhaled long-acting beta-2 agonists, which are used with low-dose inhaled corticosteroids like leukotriene modifiers and nidoquramel and theophylline. Quick relief medicines. They relieve asthma symptoms when they occur. The most common of these are inhaled short-acting beta-2 agonist bronchodilators that quickly relax tight muscles around the airways, allowing air to flow through them. The quick relief inhaler should be used when asthma symptoms are first noticed, but should not be used more than 2 days a week. Most people carry the quick relief inhaler with them all the time. Quick relief medicines usually do not reduce inflammation, and therefore should not be used as a replacement for long-term control medicines. General tips to avoid an asthma attack. Stay away from irritants, causes of the respiratory system and allergens, and use of the medicines prescribed by your doctor. Non-smoking or exposure to second-hand smoke and air pollutants. Avoid exposure to pungent odors and special chemicals used in detergents like Clorox, Flash, and insecticides. Vaccination against influenza every year before the onset of winter. Do not overuse bronchodilators. Not to be subjected to the cold currents and stay away from people with colds.